What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. Today, I have a very special guest. She's going to tell us all about the field of forensic pathology, why she went into it, and also some tips for everyone out there. Dr. Carter, how are you doing? And welcome to the channel.
Well, thank you. I'm doing fine. I'm signing in from California. I'm in San Luis Obispo, little town on the coast of California, and it's a great, beautiful day here. I'm glad to be with you.
Oh, absolutely. Thank you so much. Can you introduce yourself and tell the viewers out there who you are and kind of what you do?
Certainly. My name is Dr. Joy Carter. I am a board certified forensic pathologist. I am this country's first Black chief medical examiner in its history. And I'm a former chief medical examiner of Washington, D.C., former chief medical examiner of Harris County, Texas, which is Houston, former chief pathologist of Indianapolis, Indiana. I've been in practice for 37 years. This is one of the few non-hospital-based medical specialties where you build on your training of anatomical and clinical pathology to determine how people have died. That's forensic pathology that is done in conjunction with police investigation and civilian investigators of civilians that pass away, whether it's in a city, county, state, or even a federal organization.
All right. Well, first of all, congratulations. That's really inspiring to hear that. You're the first African American pathologist that you said the U.S. or in your county?
Actually, in the United States of America.
Wow, that is incredible. That's
I
awesome.
was the first.
That's awesome. So, can you explain? And you were kind of mentioning, talking about it. A forensic pathologist. What is a forensic pathologist?
Well, first of all, let me go with the basics. Every medical student will study pathology their second year of medical school. Pathology means the study of disease. So it's a basic block of learning how the body functions. So there's a anatomical pathology, which is where you make a diagnosis of disease by looking at tissue, such as a biopsy for breast cancer or an amputated limb because of diabetes mellitus. But you're making a diagnosis and confirming that with the treating physician. There's clinical pathology where you're making a diagnosis of disease of the human body by looking at body fluids primarily, urine, blood, all kinds of fluids from the internal organs, making diagnosis of disease or managing treatment of disease by looking at blood, looking at urine. But that's the laboratory analysis. Those are both hospital-based and something that you'll learn a bit of in your second year of medical school. The forensic pathologist is the person that determines cause and manner of death. So we are non-hospital based. We're responsible under an appointed title through a mayor or a county commissioner group, state entities, or the federal government. And so our training is a bit longer. Usually 6 years, because we have to know every other specialty, what they do and how they arrive at disease, what they do for treatment, what they do for monitoring, so that we can be precise in determining how people have died. So we've gained a lot of notoriety because when people die in police custody, it's a forensic pathologist that is to determine the cause and manner of death. This is something where people don't know a lot about what we do, and so there's a lot of misinformation out there. We are interpreted in very strange ways through the media, but it is a skill that requires you to know anatomy and physiology, natural diseases, treatment modalities, surgical procedures, keep up with all kinds of drugs that are illicit or on the street, or those that are prescribed by doctors.
Okay. And then thinking back to your time as a medical student, did you know you always wanted to become a forensic pathologist, or was it something that during your rotations you became interested in it? Like, how did you know you wanted to do this?
I'm probably one of the few people that knew exactly what I wanted to do from the time I was 14.
Wow.
By mistake,
Yeah.
I grew up in Indianapolis, Indiana, which is the home of Eli Lilly's. And I had expressed an interest in becoming a physician, had no idea what type, but I knew I wanted to be a doctor. And I was able to get a kind of enrollment into healthcare for inner city students. And I was assigned to a Catholic hospital to assist in preparing meals for the medical staff. And that was not my forte.
Hmm.
But in the old days, the hospital morgue and the kitchen preparation area were both in the basement and in close proximity. And by mistake, I saw a dead body
Hmm.
and I gravitated towards that and I begged and pleaded, and I was actually allowed to watch the postmortem. And I knew that's what I wanted to do. I love the idea of having the answers and using anatomy and physiology. The human body is something that nobody can replicate. And I knew when I went to medical school that I wanted to become a forensic pathologist.
Got you. Yeah, that's incredible. It's always good to hear other people's reasons why they chose particular specialties, and the fact that the cafeteria as well as the morgue was on the same floor most likely kind of help you choose your career. And then you spoke about the 6 years of training to become a forensic pathologist. That's after 4 years of medical school, and then it's an additional 6 years of residency training.
That is correct.
Okay. And then, are there any other subspecialties or any other like fellowships that you can do after that, or what are some other options that students can do?
Well, the forensic pathology is the fellowship. That's the ultimate training that you're going to have, and that is with a coroner or a medical examiner office.
Hmm.
And I just do want to add that when I gained my interest in forensics, I also applied for someone to mentor me.
Hmm.
And it was that mentor, and this is way before the age of computers or cell phones, it was by handwriting. But that doctor agreed to mentor me and gave me advice, clued me in on what the field really was about, and that kept me going and kept me focused. So um, I do always recommend that if you have an interest in whatever type of medicine, that you ask somebody in that field if they're willing to share some information and some guidance with you. Uh,
Yeah, I definitely agree with that. Having mentors is essential. Whatever specialty that you want to go into, finding someone in that field that has been through it and kind of guide you along the way. And I always tell students that you can't get through this process alone. It's a joint kind of process. What is a typical day for you as a forensic pathologist? Like, how do your days start? How do they end? And what do they look like? If there is a typical component to it.
well, I must say, as the chief, your day may not end. You're pretty much on call 24/7 in case some emergency happens, and deaths that are particularly violent deaths or unnatural occur anytime.
Mm.
But the usual day begins with looking at cases that have come in overnight, reviewing reports, and deciding which one of those cases actually needs what type of in depth examination. You can start off with a review of medical records, and that can make a determination of manner of death and cause of death. You can also have what we call an external examination, where the outside of the body is noted for characteristic scars, lesions, um, hair color, skin, size, shape, along with medical records. You can do a full autopsy, which is where you have the external examination combined with a complete internal examination of all body cavities, along with toxicology. So it does depend on the situation or what we call the circumstances of death, how much information the investigators are able to gather, which would be um, uh, a social history, a medical records if available, speaking with their physician to find out what they knew about them and what they were being treated for, or if it is something like a traffic accident, drug overdose, or homicide, we will be looking at a police report, and then we determine what order the cases are going to be performed. And then afterwards, you're going to give that information to who needs it. Generally, it would be law enforcement. Sometimes it might be a government agency. And then, of course, you want to make sure that above all, the family has an understanding as to what happened to their loved one. And then carefully, the body must be released to the appropriate funeral home so that the body can get to its final resting place and the family can say their farewells.
Wow, that's a lot. How long does it take? You mentioned kind of reviewing the charts, talking to the different physicians and law enforcement. How long does that take to gather all that information and then do an autopsy on a patient who passed?
Well, it does depend on what information is available, but generally I will review the investigative report and then I'll ask some additional questions, things that I know need to be answered, such as what medication was this person on, was he seen at a hospital, or is there an ambulance run sheet, is there any type of medical ailment that could cause a sudden death? So I generally have other questions to ask. So it could be something as great as an hour or two. Sometimes that case might be set aside until the appropriate information is gathered. It's just like if you're going to do surgery on somebody, you want to make sure that you're going to remove the right leg that needs to come off and not the wrong one. So circumstances of death are extremely important. And again, the forensic pathologist has to be able to read and interpret medical notes, soap notes, understand medication that's been prescribed and how that could play a role in someone's death. So that time is very important. And the post-mortem examination can be anywhere from, if it's a complete examination, can be an hour or two to, if I'm doing a homicide examination, I give it my all, and I usually average 4 hours to do one of those cases.
Wow. And then can you describe the process? In the medical school, we went to the coroner's office and helped with an autopsy. And I remember making the incisions on the chest and looking at the heart and weighing the heart. But for the people out there that haven't went through medical school or in medical school and haven't done a rotation yet, can you describe briefly that process? Like, do you have a systematic way that you do everything from head to toe, or what's kind of that process?
Certainly. There definitely is a process. In fact, there's a national group called the National Association of Medical Examiners, and there's autopsy standards. We, of course, do more autopsies than anybody. Autopsy is the determination of death, and it is a complete examination of the human body. And since our patients do not talk to us, and yes, we call them patients, I like to be very focused, detailed oriented on the person that I am examining, making sure, one, that there's a tag on them that says who they are, that name is spelled correctly, that it is the right person. I'm looking at their eye color, their hair color, chin hair or not, body type, their nutritional status, their moisture of their mouth. I'm looking for any scars, any developmental abnormalities. I'm really paying close attention during that external examination, because I'm going to be dictating a report, and I want you to feel like you're in the room with me. So it has to be detailed oriented. And if there are injuries, then those have to be noted. They have to be measured. They have to be photographed precisely. We use a lot of photography. We also use x-rays or CAT scans sometimes to see what we can see underneath the skin. And inside of the body, it is making the Y-shaped incision that's often shown on TV. And being able to determine the rib cage, is that normal? You need a rib cage diaphragm intact to breathe. So what do those look like? We go through that layer, and then you have the chest organs, which are the heart and the lungs. And then you have the abdominal organs, the liver, the spleen, pancreas, the intestine, the kidneys. I'm going to look at all of those things as well as the amount of fat surrounding the organs.
Hmm.
And I'm going to also take specimens from urine, blood, and also the vitreous, which is the ocular fluid, for drug testing.
Okay. Wow. So I have an idea of this, what you may answer, but for the students out there, people watching, how do you get inside the brain, the skull, and also the chest? What instruments are you using?
The first thing you use is a scalpel. It's very
Okay.
similar to what surgeons use, but we use a scalpel to make the Y incision. And then beneath the skin, we do use a saw, or we use a heavy bladed instruments to cut the rib cage.
Mhm.
To examine the head, we use a scalpel and we make an incision behind the ears, and we reflect the scalp, and then we use a bone saw, to open the skull. A professionally done autopsy, you should never actually be able to tell that an autopsy was done, to be honest.
Oh, I didn't know that. Okay. And you really have to be really adept, well versed in every part of the body. Like you said, you're going from head to toe. You have to know the
Yes,
eyes, how the heart works, lungs, kidneys, interpreting all the labs. So that's why the training is probably so long to become a
correct.
pathologist. Okay. And then you mentioned that you are on call every so often. How often is that?
Well, as the chief, I've pretty much always been on call. I've been on
Yeah.
call since I was probably a third year in medical school,
Hmm.
because the chief has the total responsibility for the staff. The
Hmm.
buck stops with me. I have to make that final decision. And I mean, I certainly can get some time off, but there are times when I may have to drop what I'm doing and return back from wherever I've been because something has happened. But that's a part of being a chief. If you're assistant medical examiner, you don't have the same level of responsibility. And so the assistants generally would be on call perhaps one weekend out of the month and maybe every 2 or 3 days, depending on what size office they're in and how busy they are. Major cities like New York, Chicago, Los Angeles, Miami, Washington, D.C. have quite a few doctors, and they usually pair up on weekends. These are 24-hour offices, and these are 7-day a week positions.
Okay. So that's more clear now in terms of kind of what you do and kind of how your day goes. For the students out there that may be interested in your field, what type of advice would you have for them?
First of all, I think it's important, if you have an interest in one particular type of medicine, read up on it first of all. Please don't believe what's on TV. You can actually perhaps take a tour of your local coroner or medical examiner office if they will allow that as students. And then if you have that interest after reading up on it, then I would try to contact somebody in that field to see if they can give you some more insight into what actually goes on.
Hmm.
Just don't take that media perception that we get every case solved and completed in 30 minutes, because that's not true.
Yeah, that was another question for you. How often does it happen where I have no idea why this patient passed away? Does that happen often?
It doesn't. And that's why you have to have the level of skill. You've got to retain that knowledge on how the body functions. Generally, I'd say 3 to 5% of the time, you may not have a clue. But if you have the knowledge, the body gives you the clue, and you have to pay attention to it. This is why you can't rush. You have to understand certain pigmentations
Hmm.
can indicate someone has been exposed to wind or rain or even gasoline fumes. And you have to understand how certain diseases present on the body. We can have a change in the shape of the pupil that can indicate that there's heart disease or there's congenital heart disease. So it really is part of that cerebral activity, learning all that you can and then honing those skills. So definitely detail and being perceptive and looking at all information available, weighing that with what the body is telling you.
Awesome. Well, Dr. Carter, you're a real inspiration to everyone out here. You know, I was telling you before this call that, you know, I've never met a Black pathologist or forensic pathologist at that before. So just to speak with you tonight, you know, it's definitely an honor. For the students out there that, or anyone who wants to contact you, where can they find you?
You can actually find me on the internet, and you can actually contact me through the internet. Just look up Joy Carter, Dr. Joy Carter, or look up Black forensic pathologist or forensic pathologist. My name should come up. And I make it a habit of helping students, because I would not be where I am today if someone had not helped me.
Excellent. I love it.
You can also find me on Facebook too.
Okay, awesome. I'll put links to those in the description. But Dr. Carter, thank you so much for coming on and telling us about your path to forensic pathology and what it looks like in a typical day for you. I learned a lot, you know, and definitely inspired by your story. So thank you so much.
Thank you for having me.
Absolutely. And for everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.